Greenleaf Pharmacy presents tuberculosis screening. In England in 2017, there were 5,137 TB cases. 71% of cases were among non-UK born people. Rates have fallen in the UK significantly in the last few years. TB has been ranked as one of the most deadly diseases in the world, and its incidence in the UK is significantly higher than other countries in Western Europe. The data from Public Health England shows a 38% fall since 2012, with a 9.3% decline in cases in 2017 alone. But England still has one of the highest rates of TB in Western Europe, with just under 5,200 affected in 2017. In Reading, the rate of tuberculosis is 26.4 per 100,000, which is more than 2 times the average across England. Often a lack of adherence to TB treatment regimens is to blame for such a high prevalence. However, Reading has proven to have excellent treatment completion rates for TB. So what has led to such high numbers within Reading? It appears that this asymptomatic nature of latent tuberculosis, alongside stigmatisation of the condition, are preventing people from coming forward for testing, and therefore preventing early detection. And with TB ranked as one of the most deadliest diseases in the world, it is important that this issue is tackled with great urgency. We therefore propose a tuberculosis screening and vaccination service to be provided within our pharmacies, which are conveniently located across Reading. TB Tuesdays, a pharmacy-based tuberculosis screening and vaccination initiative with the aim of increasing public knowledge of TB, as well as reducing TB rates within Reading. We believe this will make TB services more easily accessible to members of the public and support Reading Health and Wellbeing Board's aim of reducing TB incidents. This service will be available throughout the week on an appointment basis, and each store will have a dedicated day when they provide a walk-in service. All those identified as eligible will be offered the MAN2 test. In the event of a positive result, the patient will be signposted for further investigations and treatment. In the event of a negative result, the patient, if eligible, will be provided the BCG vaccination. This will be administered during the appointment with consent from the patient and will help to prevent them from contracting TB in the future.
So who's eligible? Any patient that has been signposted to the service or has been identified by the pharmacist or themselves as having risk factors of TB. These include being aged 16 to 35 years old, living in crowded living conditions, having spent 3 months or longer in a high-risk country, having moved to the country in the last 5 years, or being homeless or drug dependent. Patient safety is our number one priority, and therefore all staff members of Greenleaf Pharmacies will be required to undertake education and training courses with regards to performing the MAN2 test and BCG vaccination. Such training methods include a vaccination training programme for the lead pharmacist, a facilitator guide to be used by our pharmacy staff alongside a DVD or podcast, information on referrals with regards to local specialist centres, support groups or other healthcare settings where suitable. Standard operating procedures for our service will be in place using sources such as the Green Book and NICE guidance. There will also be an opportunity for members of the pharmacy team to train as TB champions and run outreach services to educate the community on TB. With the cost of treating latent TB at £5,000 compared to £50,000 to £70,000 for active TB, this service will not only save the NHS from future potential substantial cost, but also contribute to the eventual eradication of TB within Reading. In our pharmacies, there will be posters and leaflets available for patients to take and be made aware of. Additionally, we will be holding continued information days for volunteers at local soup kitchens, hostels and needle exchanges to encourage referral, with leaflets regularly replenished at each location. Further marketing strategies include a press release and using social media such as Facebook and Twitter. Our service aims to increase the diagnosis of TB, raise awareness of the disease, reduce stigma and provide treatment to those infected. We have covered several of the NHS tuberculosis strategy, and these include improving access to services and ensuring early diagnosis, improving BCG vaccination uptake, and providing universal access to high-quality diagnostics. Using TB Tuesdays will tackle TB at the heart of the Reading community. Our service aims to improve patient health, save NHS money and redistribute the workload between healthcare professionals and reduce the burden on them. Thank you for considering our proposal.